So improving quality together is all about having an opportunity to share a standardised model for improvement with every member of the organisation, having the shared language and making improvement part of everybody's job.
But I'm taking away a lot of the information from the course to actually make a difference in the job that I do.
Particularly for staff who've never been subject to this field before, it gives you an excellent synopsis of what quality improvement is. But it also demystifies it.
I've certainly got a greater knowledge and understanding now of quality improvement methods and the skills. You know, we've learnt a few tools and methods that we can apply in everyday work, really, when going into teams and departments.
I think it's going to give me a much greater understanding and knowledge of the methods and applying those skills and tools and techniques.
I think it will release some of the untapped potential that we've got in the workforce, whose voices aren't normally heard, whose ideas aren't normally brought to the surface.
What it gives is our frontline staff with the skill base to then go into their own departments and their own systems and say, I can actually make this improvement myself.
And it's also been quite useful to mix with people from different backgrounds and get different perspectives on what is fundamentally a common agenda, but we might be tackling it from different ways.
Having this uniformity across Wales will allow us to speak the same language. We'll be able to compare like for like. We'll be able to share best practice, really, and it will just hopefully allow us to improve everything.
It reinforces that focus that the patient is at the heart of healthcare services and the end user's perspective.
It sounds silly, but sometimes when we do quality improvement, the patient's not always at the heart of what we do. We often try and change processes and change pathways, A, for what we think the patient wants, or B, what's easiest for staff. What this now does is puts the patient at the heart of improvement. Quality improvement is about patient-centred care.
It is patient-driven. It's also staff-driven as well, because staff experience repetition and duplication of processes within a process map. If we reduce the duplication, then we take away some of the stress and strains on the staff during the day as well, because they're not chasing the tails trying to keep up with processes that aren't always as efficient as they should be.
And what this course has done for me is to actually help us think about what are the steps that we take to deliver that care to the patient, what are the processes involved in that.
If you can feel involved in making changes and improving things, then the satisfaction that you have at work is going to improve, and we all need to go away at the end of the day with a sense that we've made a difference.